Hi, Vanetta with ReleaseWorks, where we help you get a body that feels great. I'm here today to talk to you about one of the contributing factors to back pain, specifically unresolved, unaddressed scar tissue from abdominal surgeries. Now, it's easy to think when we have back pain that the problem is our back. Certainly feels like it. My experience has been, though, one of the contributing factors is often in the front, and we can't ignore the front when we have back pain, especially if you've had abdominal surgeries. If you have, there's going to be scar tissue reaching, growing, spreading throughout your abdominal cavity. This can reach up and grab under the ribs, into the intestines, the internal organs, the bladder, reach down into the pelvic bones, wrap around hip bones, reach back into the sacrum, and wrap into the vertebra, pulling all of those forward, squeezing, tightening, restricting, and causing back pain. I'm going to show you how to treat that scar tissue using one of our favorite tools, a soft inflatable 4-inch ball. Essentially, we're going to take that ball, I'll grab one in a minute, we're going to find an area that's tight, hard, or tender in our abdominal area. We're just going to lay on that ball, allowing our body to sink and soften and settle over it. Here's how we're going to do that. So once you find your ball, you're simply going to use it into any abdominal area that's tight, hard, tender, or just along any areas of scar tissue. Again, that can be gallbladder, C-section, any abdominal surgeries, appendix removal. Place the ball into that area of your abdomen as you lay on your stomach. Let your body sink and soften over it. I've had a couple C-sections. My area of trouble is generally around the left hip. For some reason, scar tissue just wrapped around that left hip. So I'm going to treat there. Join me. Join me even if you haven't had abdominal surgeries. You still need this, especially if you have back pain. Find your ball. Let's find an area that's tight, hard, or tender, and sink over that for a few minutes. So again, the area I have trouble in, it's usually right inside that left hip bone. For some reason, scar tissue attached really tightly there. Now you may notice, as you first lay on the ball, it's a little sore, it's a little painful. For me, I start to get pain that wraps pretty quickly around my hip and straight through to my back. I know it's scar tissue. I also know to let my body just sink and soften and settle. So you don't really want to stay up on your elbows. If that's too intense, move the ball, soften it a little, let some air out, or maybe lay on a softer surface. But if you can, start to settle and sink down over that ball. Let your body soften. Let any clenching or bracing in your low back, your hips, or your glutes just kind of ease away. Quiet your mind, maybe put on some soft music, and sink into feeling. That tissue's going to change, and as it does, it might be intense. That's okay. You want to be mindful of clenching or bracing. Slow your breathing. Let your body soften and settle over this ball. Three to 5 minutes is a good minimum. Longer is better, especially if you're feeling things change or intensify. You're able to stay soft and melting over the ball. Stay longer. In the initial stages of treating abdominal restrictions, scar tissue, adhesions, it can be intense. Be mindful of any clenching or bracing. You're going to be fine. Sink and soften and allow yourself to feel. Let us know how that goes. Again, if you have back pain, treat the front. Use your ball, sink and soften. Let us know how it goes.